Hi, Judith. Hi, Tony. Tony, shall I
Give it a go.
Give it a go, saying your name. I did ask Tony to tell me how to pronounce his name about 5 times because I was really worried about getting it wrong. Tony Senanayake.
That's perfect.
Okay, and with that out of the way, I think we can actually talk about using data and evidence to make an impact. So the first question I wanted to ask you both is about what data is most important for an organisation as they're kind of starting up. And Judith, working for Charity Entrepreneurship, I thought I'd toss this one to you first.
Yeah, thanks, Grace. And I will answer this question sort of from the perspective of charity entrepreneurship, where we kind of even take a step before that and start by thinking about what data do we want to have before we actually recommend an intervention for a new charity to get founded on. And there, ideally, we'd like to see 4 kinds of evidence, 4 kinds of data, 4 sets of data. And the first one there is that we really want very substantial convergent evidence in the scientific realm that this intervention is actually going to work and actually going to make an impact. So ideally, we'd like to see really good evidence like meta-studies or randomized controlled trials, RCTs, that are really high quality and that show this evidence is going to work in different contexts robustly. And we would love, we also talk to experts a lot to figure out what would be good interventions to launch. And we really like to see when lots of experts from different disciplines, from adjacent disciplines, agree on that this could be a good intervention to actually launch. So what we really like at CE is when there's convergent evidence. So when all these different studies and when lots of different experts with different viewpoints and different methodologies point in the same direction, that this is going to actually work. So that's the first one. The second one is we want to have really good cost-effectiveness estimates that show, okay, this is what it's going to cost to have this sort of organization do this sort of work, and this is what the impacts that we are expecting from this work. So having a relation between those. And we're really rigorous with these at Charity Entrepreneurship. We're trying to consider all the counterfactuals. So what else could the co-founders be doing with their time? What else could that money go to instead? So that's the second one. The third thing that we really want to see is geographic assessments, so finding an implementation location for a new charity where there is actually a really big need that this intervention could address. And at the same time, very low limiting factors or complicating factors that would keep that from working in this location. And finally, and that's probably the most important one for me, it's kind of my pet peeve, is having a really good theory of change where every step along the way is testable and falsifiable. So a theory of change is like a model of the charity intervention that goes from the activities and inputs of the charities to the output of this charity, and then to how this is actually going to cause impact in the world. So the thing that we actually care about, like saving lives or easing suffering. And if you don't have that, then it's really hard to test your assumptions. And we really want new charities to spend their first months when they're starting to implement really rigorously testing all their assumptions one by one and trying to destroy the theory of change a little bit.
And then Tony, can you tell us a little bit about like how you think this kind of, or what data is required as an organisation grows and how that might change from, you know, a small incubated startup at something like Charity Entrepreneurship?
Yeah, so I'll mirror a lot of what Judith says and maybe discuss this question from the point of view of the startup and organisations themselves, which is who we generally work with. When we think about data, in the end, the whole purpose of it is to answer key questions. So the right data is the data that will answer the demand. It'll answer the question. So really the question for us then is what tool will provide that data? So when organisations are in their startup stage, essentially what they're trying to determine is product market fit. And we leverage a lot of the same tools and systems that Judith just discussed. Needs assessment. Is this actually what the organisations need? The beneficiaries, is that what they're actually looking for? As well as literature reviews. Now, once organisations start developing a little further and they have a product or a service which there is a deep need for and there's literature to back up, we're now thinking about implementation. Can an organisation actually go out into the field and implement? Can a Fortify Health actually fortify wheat? Can a new incentives in Africa actually get SMS reminders working and needles into arms, for example. And so we start thinking about monitoring systems. What are the KPIs that should be measured? And process evaluations. Now organisations might have a process which works and evidence to back it up. That's when we start thinking about impact evaluations and randomised controlled trials to really understand impact and communicate to a wider audience the effectiveness and cost effectiveness of a program.
Yeah, I love how you mentioned that kind of impact evaluation is something that really comes at the end after we do all of these other steps and get all of the other things in place. So the next thing I wanted to hear from both of you is maybe some case studies on where you have seen data and evidence really amplify the impact that an organisation has had. Tony?
Yeah, so I'll give an example of some work that I've been involved with an NGO in India called Educate Girls. Now, this organisation seeks to get out-of-school girls who are based in rural and underserved communities into school. And they do this by deploying frontline workers into these communities. They literally go door to door, identifying girls who should be in school and aren't, and help them get enrolled. Now, in the past, the way Educate Girls went about doing this is using anecdote and intuition to try and identify those communities that may have relatively more out-of-school girls in them. What we've done is we've used machine learning techniques, publicly available information such as the Indian census, there's national surveys and administrative data, and combined that with some of Educate Girls' private data to build a machine learning algorithm that predicts communities that we believe are more likely to have relatively more out-of-school girls. And the idea is if the organisation is able to deploy their limited resources, in this case the frontline workers, to the right communities, they'll be able to get more out-of-school girls into school. And we predict that over the last 5 years, by using the algorithm, the organisation's been able to identify over 600,000 more girls than using the technique that they were using before.
That's very impressive. Judith, did you want to share a case study with us as well?
Yeah, I'm thinking of New Incentives, which is now a GiveWell recommended charity, and it was founded something like 6-7 years ago. And the original idea of New Incentives was to provide conditional cash transfers to women who were HIV positive for them to give birth in hospitals instead, which significantly lowers the risk of their children contracting HIV. And this intervention turned out to be super cost effective. But when they actually started implementing it, one thing that it turned out was that there just was not a big enough overlap between mothers who were or pregnant women who were at the same time identified as HIV positive and were able to go to a hospital for giving birth. And they only realized this through the implementation phase. But after they collected this data, they were like, okay, let's see what else is out there. And the topic of vaccines came up. And they already had this great structure in place for providing conditional cash transfers and a lot of connections to hospitals and healthcare staff. And so what they did is they decided to pivot, use the resources they already had, but change the intervention to something that would be much more scalable. And so in the end, just much more high impact. And I guess this turned out pretty well because they're now GiveWell recommended. Seems like a pretty good stamp of approval. Yeah.
I love hearing those stories where we see a really positive pivot, and especially where we're actually using evidence to then create more impact. I think that's really at the heart of what the effective altruism community tries to achieve, and I think that's such a great example of it. So the next thing to talk about is, I guess, some different areas that you think that we have some opportunities to utilise data and evidence better, because as much as the community is often focused on using data and evidence, I think there's still a lot of ways for us to improve. So I'd be really interested in hearing your thoughts on that. Judith, would you like to answer first?
Yeah, I would love
if
to.
you have thoughts.
Yeah, so the thing that I would be most excited about is aimed at the EA community, at us here, and at the EA community worldwide. And it's for us to improve the way that we use data and evidence in our organizations, but also in our different cause areas. So The point where I'm sort of coming from is that I really like this idea of EA that you've just stated, of like thinking really critically and of using rationality and data and evidence to do things better, and for having a really high bar for what counts as enough impact and for good enough evidence to believe something is true. And I think the global health and development space has done really well in this, in using data and evidence to being really critical about stuff. And I would like for us to take this mindset that has sort of founded GiveWell and found so many amazing organizations that are now GiveWell recommended, and new organizations that are being founded on these principles, and take this mindset and bring it into our organizations and bring it into other cause areas as well, these virtues. So for example, the animal welfare space, especially the wider animal advocacy space, which is not effectiveness focused, does have a quite pervasive lack of data and evidence. There's a lot of interventions for which there are just not a lot of evidence yet that it actually works. And I would really like for us to go and create that evidence and be that change so that we can decide whether or not to actually work on these things and put money into this rather into something else which could be more effective. And then the same is true for the EA meta space, for community building, and also for long-termist cause areas. These are just really, really new fields where there's just not a lot of established best practices. And I think that's a bummer, and I really want us to create those. Like, there is no GiveWell of EA meta, of community building, that evaluates organizations and best practices. And there is no ID insight that you can sort of contract if you want to do some monitoring and evaluation on your long-termist policy org or something. And so I think we should change that. And it's going to be hard because these are new cause areas, but I think it's really worthwhile. Because if there's anything, that global health and well-being has taught us, I think, is that it's really, the world is just so damn complex. And you can't just assume that something works just because it kind of sounds good.
So is charity entrepreneurship going to incubate some GiveWell-style organisations in animal welfare, long-termism and EA meta?
Well, the answer is maybe. It's a definite maybe. We are considering a monitoring and evaluation organization for EA charities, but that depends on whether there's a demand for that and whether it's going to make an actual change.
Awesome. Well, I can't wait to see. Tony?
Yeah, well, I've had chats with charity entrepreneurship about exactly that. So I think there's a lot of opportunity in that space. I'll focus more on the global development and health space because that's what I know. And I'll focus this where you focused on the aid space, on those of us in this room who have relatively more privilege, which I'll absolutely put my hand up as being one of those. I think there's a great opportunity to use data and evidence to bring voice and power to those who are underprivileged and don't have as much relative power. And so in this case, we can think about really understanding the preferences of the beneficiaries for whom we serve. There was a picture actually on Lily's presentation before of a street which was just flooded with individuals and these electrical cables which just look like snakes in the sky. That's Delhi. That's where I live. And I think it's just a very interesting case study because it is a city that is absolutely wrecked with air quality issues, to an extent that I couldn't even put into words how bad the air quality is. Yet despite that, on an annual basis, hundreds of thousands of individuals are moving to Delhi. And if projections continue by 2030, it will be the largest metropolitan area in the world. Data and evidence can help us understand why people are making these decisions. Ensure that, at a best case, we understand the preferences of individuals. And at a worst case, we ensure that we're not imposing our privileged views on these individuals because we're biased. Unconsciously or not, we are biased. And I think data and evidence really gives us a great opportunity to try and minimise the risks of that bias. So that's something where I think there's a really great opportunity.
Absolutely. And that's something that I know that ID Insight does quite a bit of work on. So just fantastic. So we are about to wrap up, but before we do, I thought I'd give you both a chance to quickly pitch your talks for the rest of the weekend, because I know that everyone will want to come along and see them. So Judith, can you tell us what you're going to be talking about this weekend?
I'm going to have a talk and a workshop on Sunday. And the talk will be about charity entrepreneurship and how we work. So both about how we do our research using data and evidence to find the best new ideas for new charities to launch, and then also the Incubation Program about how we train individuals to launch these ideas. So that's what the talk is mostly about. And the workshop will be for people who might be interested in founding a charity or a nonprofit by themselves or through our incubation program to help them figure out whether they might be a good fit for this.
Great. And Tony?
Yeah, well, I'm going to be at those presentations because charity entrepreneurship is absolutely fantastic. We've worked with so many of those organisations that have been incubated. So what I'll be presenting on is really providing an insight into what the actual job of working in global development and health actually looks like, and sharing a few examples of projects. It is an incredibly exciting space. There are thousands upon thousands of opportunities and organisations that are doing truly incredible things, effective and highly cost-effective, much more than the 9 organisations you see in GiveWell and maybe the few more that are on Giving What We Can in the Life You Can Save. I think there's really an opportunity, a very nascent opportunity at the moment to support organisations to help understand and identify the effectiveness by using data. And that's what I'd like to talk a little bit about tomorrow. It's more than just running RCTs. We can do so much more, and it's super interesting. Data science, machine learning. There's a lot of innovating, exciting stuff happening in global development and health.
Yeah, I'm super excited to attend your talk. I'll just quickly mention my talk. So tomorrow, while I'm up here, so tomorrow I'm going to be talking about what we're learning at Giving What We Can about spreading the ideas of effective altruism and effective giving. And my colleague Luke, who you saw before, will be joining me for a Q&A there as well. We also have a meetup on Sunday for anyone interested in effective giving. We would love to see you all there. And thank you so much, Judith and Tony, for speaking to us today, and also for your contributions to the community more broadly.
Thank you as well.
Thanks, Grace.